Good morning and welcome. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Song Brown Primary Care Program Informational Webinar. Before we get started today, I want to make sure you're in the right webinar. Who is this webinar for? This is for new and continuing applicants of the Song Brown Primary Care Residency Program. The PCR program provides grant opportunities that will result in funding to organizations to educate and train primary care providers to work in underserved communities, and Song Brown is administered at the state level by HCAI. Talk real quick about our agenda for today. Going to start with housekeeping and introduction, followed by an overview of the program, and then we'll have a question and answer session at the end. Housekeeping rules for today. This webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the chat and the view controls in the menu bar at the top of your screens. The chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. We do ask that you enter your questions in chat. That way we get a recording of all of them. And this webinar will be recorded and will be available within 7 to 10 business days. We do have a second webinar that will be held this afternoon starting at 2 p.m. So if you know anybody who missed it and wants to get there, they can register on our website for that. And with that, it is my pleasure to introduce Brianna Romo, Program Officer for Song Brown PCR, for our opening remarks and for our webinar. Take it away, Brianna.
All right, thank you, Chris. As mentioned, my name is Brianna Romo, and I am one of the program officers in the Song Brown program. So we'll talk a little bit about Song Brown for those of you who do not know. We provide funding to education programs, which include primary care. What happened there? There we go. Which include primary care, family nurse practitioners and physician assistants, registered nurses, and midwifery programs. We provide financial incentives to programs to graduate individuals who practice in medically underserved areas, enroll members of underrepresented groups in medicine to the program, locate the program's main training site in a medically underserved area, and operate a main training site at which the majority of the patients are Medi-Cal recipients. Some important dates. Our e-app registration is now open. We opened our application this past Friday, July 25th. Our early submission review date is August 27th. Our application deadline is September 8th at 3 p.m. So some important details to know before you apply. If your program requires approval to contract from a coordinating authority, inform the authority of terms and conditions contained in the grant agreement. Applicants must agree to the terms and conditions as outlined in the grant guide before receiving funds. HCAI will not make changes to the terms and conditions specified in the grant agreement. Funding shall be used to expand primary care services, and funds shall not supplant existing federal, state, or local funds to provide primary care services. Some important changes for this year's application. The import feature has been removed, so applicants can no longer copy over training sites or graduates from their previous application. And then also underrepresented in medicine residents and graduates will no longer be scored. However, you must still provide the information for data collection purposes. Some information to gather for our program's existing expansion and teaching health center. Please make sure you have the correct organization name and address. This must match what you have on file with the IRS. Any incorrect information can delay the agreement process. Please also have your grant agreement and payee data record signatories, the facility type for each primary continuity clinic training site, the payer mix information for each listed primary continuity clinic, and the race and ethnicity data for all current residents. Some more information to gather, current practice site information for all graduates entered, the national provider identification number, any applicable required attachments, and permission from your organization to apply for the grant. For our other program, we have a new program. So some information to gather will pretty much be the same thing. It'll be the correct organization name and address, the signatories, facility type, and payer mix information. Some required documents for our new programs will be for each of the phases, A through D. They will require an attachment at the time of application. If phases D through G are selected, only a letter of sustainability will be required. Some of our funding categories will be existing teaching health center, also called THC, and our expansion category, which is new primary care residency slots for existing programs. And then all of these details will also be listed on our Song Brown website after the webinar. And then a few more categories that we offer are the new primary care residency program and the new primary care residency program with a match. Based on the phases that you have completed, you will be eligible for one of these programs. Available funding. This year we have a total of $31 million available. For existing, we do have 18.6 million, teaching health centers 5.6 million, expansion 3.3 million, and new programs 3.3 million as well. We will have some helpful resources listed on our Song Brown website. We do have the Song Brown glossary and the PCR grant guide, which you guys can refer to. All right, next we will begin discussing our e-app registration. First, if you have not created an account, you can go onto our funding portal and register for an account. If you are a new applicant, please register as soon as you can. Our funding portal has two-step authentication process for new applicants. When setting up your account, you will just click on the portal link and then make sure to select the Sign Up Now link. The next step would be setting up your profile. You would start by selecting the box that says Organization for Healthcare Workforce Support. If your organization is not in our system already, there is a button that says Request New Organization. Please note that most of the organizations are in our system already, so please use this search function before submitting a new organization name for approval. If you are adding a new organization, you will just simply enter in the organization name and then enter in the address. Please note it will take us about 5 business days to review this organization request. During this time, you may still begin an application. All right, the next step to completing your profile, you will just enter in all of the required fields. And then please note any incomplete information may delay your registration. Account rules. So if you are creating a new account, you will automatically be assigned to a grant preparer role. However, if you are a program director, go ahead and send us an email to request this role. Please note that only accounts with the program director role may initiate and submit applications. You will not be able to do that as a grant preparer. Once we approve your request, you will receive a follow-up email confirming the approval. And then, yes, please note that program directors may initiate, view, edit, and submit applications, payment certifications, and final reports. And grant preparers are limited to only viewing and editing applications and submitting payment certifications. As the role of a program director, you will have an additional tab on your profile page where you can assign other users. You will just simply click on the Add User button and give the registered grant preparer access to the applications. And then once again, only program directors can submit a completed application. Once you have the role as a program director, you will navigate to the Apply Here button on the main menu, and you'll just simply click on the Song Brown Primary Care Residency 2025 link, and you can begin your application. Okay, so now some helpful tips. Navigating through the application, there's a previous button and a save and next button that will be found at the bottom of each page. Each time you click on the save and next button, your application, the progress of your application will be saved. If you need to go back, you can simply click on the application tab and resume your application. Any asterisks you see on the page will indicate that those fields are required before proceeding to the next page. And then also throughout the application, you may see a blue circle with a question mark. If you click on that, it will just provide you some more or some additional information. All right, next is starting the application. The first page you will see is program information. Some of this information will pre-populate from the information you entered on your profile page. On this page, you will select the program type that you would like to apply for. You will also select a residency program title from a list of training programs that you will find by clicking on the magnifying glass. If your if your residency program is not listed, you will go ahead and check the box that says residency program not listed. Please note that most of these programs are already in the system, so just try to use the magnifying glass to search that. The next page is the address for your residency program. If you clicked on the checkbox stating that it was not listed, a new window will open up and allow you to enter in the address. And once you clicked on the confirmed address, it will auto-populate the address fields on the page. And you will see this validation feature throughout the application. The next step would be the award category. You would just simply select on the award category that you are applying for. Please note that you can apply for multiple funding categories in one application, but if you are applying for a new program, you cannot apply for any other categories. All right, next we will talk about the PCR new programs. So here's just an overview of our new and new with match programs. Phase A is mandatory to receive any type of new program funding. Depending on which phases you have completed and said yes to will determine which new program funding you're eligible for. And then once again, please note if you are applying for a new program, you may not apply for THC existing or expansion. So for new programs, as far as determining your eligibility, you must have received sponsoring institution accreditation or will have applied for it by the time of annual PCR application release, which was last Friday. Or you must have obtained a residency program accreditation, have no first-year residence at the time of application, and have not received any prior Song Brown funding. So you must have completed phases A through D in order to apply for new program funding. So for new with match, you must be in the process of applying for or have already received the sponsoring institution accreditation, have not received any prior Song Brown funding, and in the process of completing or have completed phases A through C. You must have not completed phases D through G yet. For new with match, you must be willing to match 25% of your organization's funds towards the total award. So if you have stated yes to phases A through C, you may apply for new with match funding. So here's an example of how new with match works. If you are awarded a grant amount of $2 million, you must be willing to match 25% of that, which is $500,000. So your total budget would be $2,500,000. All right, next we'll talk about the new program application. So for this, you'll just simply check the box new program, and then you will click on Save and Next. The first page you will see is the contract administration page. This page, you won't want to enter the contract organization name and the DBA name. Please note that this must match what you report to the IRS. You'll select the entity type, which will be governmental or non-governmental. You'll enter the signatories. Please make sure that these are authorized signatories. And you would want to verify this information with your finance office to ensure that this information is correct. If it is incorrect, it will delay your grant agreement if you are awarded. The next page is program data. You will review the ACGME accreditation phases A through G and select the response that best describes the status of each phase listed. Selecting yes, once again, to phases A through C, but no to D through G will make you eligible for a new program with match for up to $2 million in funding. And selecting yes to phases A through D makes you eligible for up to $1 million in new program funding where no match is required. So for new programs with match, the documentation will be required at the time of application for each of the phases that you answered yes. And then for new programs, only a letter of sustainability is required if all phases are answered with yes. Next will be training sites. If you selected yes to phase D, you will be required to fill out this training site information. You will simply click on the Add a Site button. A pop-up window will display, and you will complete all of the required fields. Please note that we only need primary outpatient training sites, not every training site. Next will be the facility type for your training sites. We provide links where you can verify your facility type to identify the following facilities. Please note you can only, or we would like you to only indicate a facility type that can be found. The next is the payer mix. So for this page, you will just complete all of the required fields. Please provide the payer mix information for the past 12 months. Please note that this is required for all training sites that you have listed. And this does not have to equal to 100%, but it must be in whole numbers. Please do not use decimals on this page. If you would like to go back and edit one of your training sites, you can simply click on the down arrow to either edit or delete the entries that you have submitted. Next will be the strategy questions. Here you'll indicate which strategies you plan to use in the development of your program. There are 5 questions. Multiple responses can be selected per strategy question. In each selected strategy question will prompt a narrative for further explanation. And then once you're completed with this page, you will just click on Save and Next. Next, you will fill out residency training. Here you will just indicate how many first-year residents you will initially be accredited for or plan to be accredited for. And then you can select if your residents will train side by side with F&P and or PAs. The next page will be expected expenditures. Here you will provide how much funding you are requesting or what you're eligible and what you're eligible to apply for. Once again, the maximum funding request for new programs is 1 million and for new with match is 2 million. So new programs with match applicants, you will have to complete an additional table for budget and funding. Here you will provide your anticipated or actual expenses related to each budget category listed. Please separate your costs into their respective phases. And once you have completed all sections, you can go ahead and click on Save and Next. The required documents. So the red buttons on this page will indicate documents that are required based on each of your phase responses. You will just go ahead and click on the red button to upload the required documents. And then once you upload all required documents, the button will turn from red to green, signifying that you may continue with your application. Please note that uploads may take up to 15 minutes. If you do need to delete your document, you will just simply click on the down arrow and then choose delete. All right, and this is the last page of the new program application. You'll just read the statement, agree to the statement by checking the box, and then you will click submit. Please note, once you do submit your applications, you cannot make further edits. And then also, as a reminder, only program directors may submit an application. The grant preparers will not see the submit button. And once you have submitted your application, you will see this page stating that the submission has completed successfully. If you would like to go back and view or print your application, you can go ahead and click on the application tab and then click on the down arrow, and then you can view or print your application from there. Next, we will talk about the existing THC and expansion slot applications. Okay, so similar to the new program application, you will just provide all of the requested information. Again, some of this information will pre-populate to what you have entered in your profile. You will enter in your residency program title and then complete all of the required fields, and then you will move on to the next page. And then same as the new, once again, you will just enter in your organization name, DBA name, entity type, signatories, and then once again, please make sure your organization name and DBA name match to what you report to the IRS. So for program data, having resident and graduate data to report will allow additional fields to appear for you to complete further into the application. So here you will just add all of the requested training site, resident, and graduate data as instructed on each of the pages. Training sites, once again, you will just click on add a site. A pop-up window will display, and you will just complete all of the required fields. Facility type, once again, we do provide links for this, and then you can use these resources to identify the following facilities. Payer mix, you will provide a percentage of the last 12 months, and please note that these numbers must be whole numbers. Please do not use decimals, and then these percentages do not have to equal 100%. If you would like to go back and edit one of your training sites, go ahead and click on the down arrow, and it will give you the option to edit or delete each individual entry. So for the executive summary, you will provide a summary and for your program. You have a maximum limit of 2,500 characters. If you exceed the character limit, you will receive a pop-up message. Please note that if you do copy and paste from another document, such as a Word document, it may not transfer over properly. So please make sure you double check the information that is entered before moving forward. The next thing you will fill out is funding and expenditures. This will be based on what funding category you're applying for. You will provide the number of slots requested for each funding category. If you are applying for THC and existing funding, please ensure that your slots do not exceed your program's total number of approved first-year slots. Annual expenditures for the last academic year is required for all programs except for new programs. And then please note that the information in the grade fields will auto-populate for you. Some more information you will have to fill out for funding and expenditures. You'll just complete all of the required fields shown if you are applying for THC. Please note that the total program annual budget must be equal to or more than the total requested THC song grant funding. The next thing you will need to fill out is the aggregate resident data. This is now collected for all of the years requested. Please provide the total number of ACGME approved slots for each academic year. Please note that we are no longer collecting this information at the resident level and that the total number of filled positions must match the total number of race and ethnicity of all of the residents. So for the graduate data, just make sure you enter in the graduate data before adding each graduate. And then please make sure that the numbers match. And to add the graduate data, simply click on the Add a Graduate button. A pop-up window will display. And once again, if you would like to edit or delete any of the entries, you will click on the down arrow to edit or delete. Next, you will select your facility type. Once again, you will verify your facility type by using links provided to identify the following facilities. Some common application errors. If an applicant does not enter any data for residents or graduates, even though the applicant has residents or graduates. Another common application error is if an applicant enters practice site name and address for out-of-state graduates. We only need information for graduates practicing in California. An applicant did not provide the correct. Please note that this name does need to match what is reported to the IRS. You go back one. Okay, there we go. The applicant did not provide the correct signatories or the information is correct. Or the applicant added a training program and did not search for a previously used training program. And then once again, like the new program application, you will have required documents that you need to upload. And then depending on the funding type, you will upload, what specified documents are required. Once you upload the documents, the red button will turn green, signifying that you may continue. And then once again, if you would like to delete an upload, you will click the down drop arrow to delete it. Here, you will just check the box stating that you have read and agreed to the statement. Once you submit your application, you cannot make further edits, and only program directors may submit an application. And once you have submitted it, you will receive the submission completed successfully message. And then once again, if you would like to print or view your application after you have submitted it, you will just go ahead and click on the application tab and then click on the drop-down arrow. And then here I will hand it over to Chris for the questions and answers.
Right. Thank you so much, Brianna. As you can see, our team has put a lot of work into this program, and we're so excited that you've joined us today to learn more. We're going to transition to our question and answer session right now. In the menu bar at the top of your screen, you can find the button to access the chat feature, where you can type your questions in the chat. We're going to do our best to answer as many questions as we can in the time that we have together. We do ask that if you have questions that are highly specific to personal circumstances, that you email our team at songbrown@hci.ca.gov so we can best assist you with those. Also, if we do run out of time and we don't get to all of your questions, please email us there. We do ask that you put your questions in the chat as opposed to raising your hand today. We've got a lot of people online and a lot of questions to get to. It's just a lot easier for us to do that through the chat. So with that, let's go ahead and get to our questions here. And we're working on getting the chat turned on for you. Having one issue with that. We'll have it on in just a second for you. Yeah. Yes. Okay, the chat is open, and yeah, go ahead and start getting your questions in the chat for us. One reminder is as you go ahead and start doing that, we have posted all of the important resources that you need in the chat as well. You can find the link to the primary care residency program page, the grant guide, the technical assistance guide. We have all of the dates and times there for application open and close, as well as that email address that we mentioned, songbrown@hci.ca.gov. And so, first question, Regina asks, how do we get a copy of today's PowerPoint presentation? It's a great question, Regina. We will be posting the recording of this on our website. If you click on that primary care residency program link that's in the chat, we will have that within 7 to 10 business days. We do have to get it get the captions on there so that it's ADA compliant, but we will have that for you within 7 to 10 business days on the website. Aaron asks, who is the signator if we are an FQHC? Is it DIO, Residency Program Director, or the FQHC CEO?
Okay. Just to clarify, are you asking about an agreement or an application for that question?
Let's see. On the application.
Okay, thank you for your question. So for the application, we do not require a signatory. So for the application, the program director will need to initiate the application, and they will be the ones submitting it. But we will allow them to add grant preparers to help them complete the application.
All right, thank you, Brianna. Carrie asks, can you share why the import function was disabled for prior graduates' information?
Yeah, the import feature is no longer in this year's application. We did have a lot of applicants who were not completing it correctly or updating it. We just want to ensure that all of the information we're receiving is accurate and up to date.
All right, thank you. Joni asks, thank you for your presentation. To clarify, you only want graduate data for physicians who are practicing in the state of California. This is different than from prior years.
Okay, thank you for your question. We do ask for all graduates. However, there is a separate part where you can enter in graduates who are working, out of state or who are practicing out of state. Sorry.
And that then the next question revolves around that same issue. I understand you do not want graduate data for those who are practicing outside the state of California. So when we are providing graduate numbers, do you want but only want graduate numbers for those that are practicing in California or for all graduates. So it sounds like there's opportunity for both.
Okay, yes, thank you for your question. So yes, once again, yes, so we will provide an opportunity for you to enter in all graduates for those who are practicing in California and outside of California.
Matthew asks, how does the funding allotted for this year compare to available funding last year? Last year, many applicants who met the criteria outlined in the RFA were not funded.
Okay, yes, thank you for your question. So this year we do have the same amount of funding as we did last year. Um, we did take a significant decrease last year though, which is why a lot of applicants were not able to get funded even though they met certain criteria. They might have just not met the threshold as far as like the scoring.
All right. Let's see. Kelly asks, hello, we are ACGME accredited. We are ACGME accredited to expand slots up to 8 residents. We currently serve 6 residents. If we increase to 7, is that considered an expansion or existing?
Okay, thank you for your question. Yes, so if you are currently serving 6 residents and would like to increase to 7, that one extra resident will be considered an expansion for that one resident.
All right. And Alina asks, if we have 3 first-year slots and are eligible to apply for both existing and THC, would our allowable maximum request be 375,000 per category type or 375,000 total?
We'll have to get back to them on that.
Okay, yes, thank you for your question. Alina, for that one, we will have to get back to you on that one. I will just have to look into that one a little bit further for you.
Alina, it'd be helpful if you can email our team at songbrown@hci.ca.gov, give us the details of your question, and they'll be able to answer it for you. Next question, will you be posting responses to these questions on your website? We will be posting the recording of this, including all of the responses in the recording. And again, that's one of the reasons why we do our Q&A this way, so that we capture all of that for you guys. Next question, for the statement trained side by side with FNP PAs, would you clarify if you're referring to the preceptorship programs or the Song Brown FNP PA program?
Okay, thank you for your question. So yeah, it will just be FNP or PAs to any program, not just Song Brown.
Next question, will a report with the scores and thresholds, a threshold funded for all programs be released? I recall seeing this in the past, but not last year.
Thank you for your question. Our process has changed, so we cannot guarantee that that will be available for this year.
And a similar question, how do we learn about scoring methodology and the threshold for an award?
Yes.
Okay, thank you for your question, Carrie. So for the scoring threshold, it is 50% of the total points possible. For the PCR existing, expansion in THC, it is now, the total possible points is now 90 points. Last year it was 120. And then for new programs, it is now 111 points, whereas it was 117 points last year. Thank you.
Question, does the grant have limitations on funding mid-level providers such as midwives or NPs who work in tangent with residents for service needs?
Okay, thank you for your question. So this is to support the training and education for the residents only.
We've got some time left in our webinar today. If there's more questions that you have, we've still got time for you to get those in the chat. Just a couple reminders. Go ahead and look back through that chat and you can find the resources. We'll post those again here in a second so that you can get access to them easily. You'll find the link to the PCR page, the grant guide, the TA guide, all of the application dates, and the email to contact us at. One of the things I want to remind you of, if you think of a question after the webinar and you say, oh man, I wish I would have asked this question, it's okay. Just email us at songbrown@hci.ca.gov and we'll be able to answer the questions for you. And let's see. So next question we have is, if we are eligible for both existing and THC, what are the pros and cons for applying for one to one and not the other?
Okay, yes, thank you for your question. So we just want to let you know that we do receive a lot more applications for existing than we do THC. So if I think it probably, a pro would be to apply for the THC program. You may have a better chance of being eligible and receiving an award for that program.
All right, great tip there. John asks, can the funding be used to financially support faculty time so they can precept the residents' training?
Okay, thank you for your question, John. Yes, so the funding can be used to financially support faculty time while they precept the residents' training. Yeah.
All right, great questions so far today. We really appreciate everybody joining in and participating with us. As I said before, we've still got a little bit of time left in the webinar, so we'll give you guys a little more time to think through any questions that you have. As a reminder, we will post this webinar on our webpage within 7 to 10 business days so that you can access this and send it to any coworkers that need it as well. Next question, would you review THC funding opportunities through HCAI?
Thank you for your question. Are you referring to like outside of Song Brown funding? Because if so, we would we only focus on the Song Brown program funding.
And so if you're able to provide a little more context for your question, we might be able to give you a better answer.
We do believe that Cal MedForce also provides THC funding as well.
Song Brown criteria for the THC funding opportunities. Thank you, Michelle. All right, Brianna, did that change the answer any, or is that still? All right, thank you, Michelle.
Yeah. Okay. Yes, Michelle. Yes, if you would like to follow up, that's fine. I can send you the requirements and criteria for the THC funding opportunities.
All right, thank you, Michelle. We appreciate that. And again, that's an email for anybody else who wants to follow up. If you have additional questions, songbrown@hci.ca.gov. We're happy to help you guys throughout the whole process. Quick reminder as well, we have an early submission review August 27th at 3 p.m. That's a great opportunity for you to get your application in early and make sure that everything is there in time for you to make any corrections that need to be made. The program does close September 8th at 3 p.m. And at that point, all submissions are final. Daniel asks, says, thank you for this presentation. To clarify, if we meet the minimum scoring threshold, does this guarantee at least some funding, or is it possible to meet the threshold but not receive funds? Great question, Daniel.
Hi, Daniel. Thank you for your question. So it's based on scoring and availability. So it is possible that you may meet the minimum scoring threshold and then not receive funds. So yeah.
Thank you, Brianna, for that answer. We've got about 10 minutes left today, so we'll hang on a little bit longer if you guys have more questions. And we do appreciate you guys taking the time out of your day to be with us. Also, if you know of anybody that was not able to join today and in this morning session and would like to get a chance to hear this information for themselves, we do have a second session happening at 2 p.m. This afternoon, and you can go to our website and register for that as well. Give another 30 seconds to a minute here for any other questions. Looks like we're starting to wrap up. All right, Joni asks, can we see the actual breakdown of how the scoring occurs?
Hi, thank you for your question. Can you provide a little bit more clarification? Do you want to know like the whole process of how the scoring occurs, or yeah, if you could just provide a little bit further clarification.
Joni, if you have any additional insight as to specifically what you're wanting to see in scoring, you can go ahead and put that in the chat, or you can follow up offline with us as well. Pearl asks, is there a list of resource guide for what are allowable expenses? A list or resource guide for what are allowable expenses?
Okay, yes. Thank you for your question, Pearl. We are currently putting together a list for allowable and non-allowable expenses, and we will put it on our Song Brown website as soon as we get it all put together. Yes, thank you.
Yeah, go ahead and be looking at that link for the webpage, and we'll have that up there. Next question, for section 2.2, is there a weekly hour requirement for ambulatory primary care needed for grads? Some of our grads have hybrid inpatient and outpatient roles.
Hi, thank you for your question. So for the ambulatory primary care grads, there is not a weekly hourly requirement.
All right. And Joni gave us some clarification. Thank you, Joni. She says, I would like to know how many points are assigned to each category. So how many points to graduates going into PC in resource limited sites?
Okay, thank you for the clarification. Yes, so we have all of the scoring criteria listed in our grant guide, which is posted to our Song Brown website. It'll give you a breakdown of how many points possible that you can get for each of the sections for each program.
All right, Joni, and you can find linked in the chat. You can click on that and it will pull that right up. Thank you for that question. Next question, does precepting count as primary care?
Okay, thank you for your question. No, it does not count as primary care.
All right, we really appreciate the questions you guys are asking today. Glad that we're able to be with you to give you these answers. Hopefully it makes your application process easier. Got about 3 more minutes that we can take questions. We really do encourage you to take the time to read through the grant guide and the TA guide. They're really going to make your application process a lot easier. Our team has taken a lot of time to put those resources together for you to smooth out the process for you. But we do know questions come up, and so again, we'll be available at songbrown@hci.ca.gov after the webinar if you still run into any questions. All right, I'm going to give 30 seconds more here for any questions. Regina, thank you for being with us today. And just one last reminder, Song Brown is our longest running program, and so we really are proud to be able to offer this to you guys. It's one of California's premier workforce programs, and so it's great to be a part of that. With that, looks like we're done with the questions for now. So thank you all for your participation with us in that Q&A session. We really do appreciate it. If you didn't get your question answered today, think of one later again. Please email the team, songbrown@hci.ca.gov. We really do appreciate everybody joining with us today to learn more about the Song Brown Primary Care Residency Program. And as I mentioned, we're excited to be able to offer this as just one part of our health workforce development efforts at HCAI. We're grateful for your participation with us today. As a reminder, the application period closes on September 8th at 3 p.m., so don't wait to get those applications in. As we end today, we're just going to go through a few of our additional resources. We would love for you to look through our website and see all of the other resources that HCAI has for health workforce development. Also, please follow us on our social media channels, and we would love, if you are one of our awardees, for you to share with us what you're doing on social media. Use one of these hashtags so that we can see the great work that you're doing on behalf of California's health workforce. And then one of the best ways that you can stay up to date with us in health workforce is to sign up for our monthly newsletter, and you can go to the link shown at the top of the slide there, and you can subscribe. When you subscribe, click on any of the health workforce checkboxes, and you will be added to our monthly mailing list, and you will see all of the great things that we have going on during that. You can always call or email us during the application period, and we'll be able to help you out there. And with that, we appreciate everybody joining us. We thank you for attending. With that, we conclude today's webinar. We hope you have a wonderful day.